Ever since the Ministry of Health officially declared an outbreak of cholera in Kabawa zone in Lukwago division, a number of issues have come to the fore which are believed to have caused this outbreak. Among these was the absence of toilets within the affected areas, in addition to the presence of the Naguru channel, which has been awaiting improvement and construction from KCCA for over 3 years now. These are some of the factors that have forced the Lord Mayor Erias Lukwago to embark on a fact-finding mission on what can be done by Kampala Capital City Authority to address these issues. Lukwago has discovered that most of the toilets have remained unemptied for a long time, which has made it impossible for the residents to use them. The residents have also informed the Lord Mayor that private companies that were contracted by KCCA to collect rubbish have failed to deliver on their mandate. In his remarks, Lukwago has observed that Kampala City does not have a policy on waste collection and disposal, which has in turn affected the city's sanitation. In the proposed policy, the city is to streamline the construction of toilets in slum areas, in addition to the construction of more waste recycling plants.
It is poorly managed. You find people constructing pit latrines by the drainage channel. When it rains, they drain them in the drainage channel, and then that in itself constitutes a health hazard.
He has further revealed that KCCA is to also take back the responsibility of collecting rubbish within the city, because the companies that were privately contracted by the authority to do so have failed.
The concessionaire, that is Home Killing, they have done so. They have totally failed to execute the obligations within the contract. So we have to review those contracts.
However, National Water and Storage Corporation has pledged to address some of the issues that have been raised by Lukwago. Executive Director Dr. Silva Mugisha has revealed that the corporation intends to construct over 4,000 public water points in Kampala, Wakiso and Mukono between now and 2021.
These public water points we are installing, water is going to cost 25 shillings per jerrycan from National Water side. And the caretakers who shall give those water points will be asked not to cost more than 50 shillings per jerrycan. And also the sludge handling facility will also be constructed at Naguru. So it is an integrated project that combines sanitation and water.
Meanwhile, Minister of State for Primary Health Care Dr. Moriku Kaducu has paid a visit to the isolation center that was established at Naguru Hospital to offer treatment to cholera patients. Here, Kaducu has denied claims by the patients that they were forced to pay money to receive treatment.
They were not asked any money. They got treatment for free from the time they came up to today.
Efforts are still ongoing by a number of government agencies and institutions to address the cholera outbreak in a bid to prevent it from spreading to other parts of the city. Joyce Nakato, NTV Weekend Edition.